Hi everyone, I am Dr. Krishna. Hope you all are doing good, and in this video you are going to learn about the gross anatomy of human skull. This video is helpful for both theory and examination of NEET for both BDS and MBBS students. Hope you all enjoy this session. Without delay, let's get started. There are mainly 5 views for the human skull. They are norma frontalis. The one you are seeing is norma frontalis or anterior view, and next is norma occipitalis. This is the occipital bone, right? So the occipital bone which represents is norma occipitalis or posterior view, and next is norma basalis. Norma basalis is inferior view, and norma verticalis is from the top, that is superior view, and the last is lateralis, that is from the lateral side. What are the 5 views? Norma frontalis, norma lateralis, norma occipitalis, norma verticalis, and norma basalis. These are the 5 views of the skull. The skull consists of 28 bones. Among them, brain case. Brain case is also called as calvarium. It consists of 14 bones, including 3 paired ear ossicles, that is malleus, incus, and stapes. And the face consists of 14 bones. Among the calvarial bones, or the bones that are present in the brain case, there are again divided into paired bones and unpaired bones. What are the paired bones of the cranium? There I will show you here. Paired bones of the cranium are, see here in this diagram, you can clearly see that these two are paired bones, that is parietal bones are paired bones. Also temporal bones of the cranium are paired bones. Next, malleus, incus, and stapes, that you can't see here, but they are the 3 ear ossicles that are present on either side of the skull. Okay, did you got this difference? Parietal bones, temporal bones, malleus, incus, and stapes. These are paired bones of the cranium or brain box. Next, the unpaired bones of the cranium. The unpaired bones of cranium are frontal bone, your frontal bone, and occipital bone. Here is your occipital bone. Next, let's change the view. Yes, this view we can see the remaining 2 other bones. They are sphenoidal bone and ethmoidal bone. Sphenoidal bone and ethmoidal bone. These 4 are unpaired bones of the calvarium. What are they? I will repeat again. Frontal bone, occipital bone, sphenoidal bone, and ethmoidal bones. These 4 are unpaired bones of the cranium or calvarium or brain box. You can call with any of the name. Right? What are the paired bones of calvarium? They are parietal bone, temporal bone, temporal bone, and malleus, incus, and stapes, which are present in the inner ear part. These are paired and unpaired bones of the cranium. We have seen the 14 bones of the cranium or brain box, right? Now let's see the 14 bones of the facial bones. What are those 14? Among those 14, we have again paired bones and unpaired bones. Let's see them. The unpaired bone of, first let's finish the unpaired bones of the facial bones. They are mandible. Mandible is the unpaired bone, and the other unpaired bone is vomer bone. Let me show it. See here, the yellow color part which was highlighted is vomer bone. What are the unpaired bones of the face? Repeat with me. Mandible, and the vomer bone. These 2 are unpaired bones of the facial bones. Among the facial bones, unpaired bones are mandible and vomer. Now let's see what are the paired bones. Paired bones of the face. What are they? They are maxilla are paired bones, and zygomatic bones, which are highlighted with the yellow color. These 2 are zygomatic bones. Nasal bones. This red colored one are nasal bones. These 2 are nasal bones. And next one are lacrimal bones. these are your lacrimal bones. See here, highlighted with the blue color, right? These are your lacrimal bones. And palatine bones. Palatine bones you can see on the posterior side of the, inferior side. You can see here, these two are your palatine bones. Okay, these two are your palatine bones. And next, inferior nasal concha. Inferior nasal concha you can't see in all these views. Let's see in cross section. In the cross section of the skull we can find them. These are your inferior nasal concha, that is your palatine bone. See here, you can see that these are your inferior concha. Got the difference, right? What are the paired bones? Repeat with me. Zygomatic, maxilla, palatine bone. This green color is palatine bone. Nasal bone, lacrimal bone. Here are your lacrimal bones. And inferior concha. Vomer is the unpaired bone. Here is your inferior concha. Here you can see clearly that inferior concha. Okay, these are the unpaired bones of the skull. Paired and unpaired bones of the skull are explained very clearly. Till now we have learnt the paired and unpaired bones of the cranium as well as the facial bones. Now let's learn regarding the sutures of the skull. I will show you clearly and explain about them. Here you can see the coronal suture. This is called as coronal suture, that is present between the parietal bone as well as the frontal bone. The suture that is present between the parietal bone as well as the frontal bone, and it runs from side to side, and also if we do the craniotomy, then you can see that this coronal suture runs downward and in forward directions. These are the highlighted lines that you should write in your examination. The coronal suture, this is placed between frontal and two parietal bones, and the suture crosses the cranial vault from side to side and runs downwards and forwards. That is regarding the coronal suture. Now let's learn about the sagittal suture. See here, this is your sagittal suture, right? This structure which is present over here is your sagittal suture. It is placed in the median plane, right? If you draw a line over here on the skull, see, this is the median plane of the skull. So where is this sagittal suture present? In the median plane of the skull, this sagittal suture is present. And in between what bones? On either side by the parietal bones. It is separating the parietal bone on either side. That is the regarding the sagittal suture. Next is lambdoid suture. Lambdoid suture, you can clearly see that it is like the shape of lambda, right? So that is the reason why it is called as lambdoid suture. It lies posteriorly between the occipital bone and two parietal bones. And it also same like the coronal suture, runs downwards and forwards across the cranial vault. Okay, next, in 3% of the cases, in only 3 to 8% of the cases, here there will be small suture lines that we can see in the human skulls. How much percentage? 3 to 8% of the cases. These sutures are called as mitopic sutures. Okay, these sutures are called as mitopic sutures that are seen on the frontal bone. It usually closes or fuses by the age of 6 years. It usually fuses and closes in most of the individuals. You can see it only in 3 to 8% of cases. These are the various sutures that you see in the human skull. Apart from the coronal suture, sagittal suture, lambdoid suture, there is also few other sutures that you have to learn. They are temporal suture, This is the temporal bone, right? So, and here is your zygomatic bone. Between the two, there is a suture that is called as zygomatico-temporal suture. And also, if you see, this is the frontal bone, and here is another suture that is called as zygomatico-frontal suture. This is the zygomatic bone, and here you have maxilla. So between these two, there is a suture called as zygomatico-maxillary suture. This is the zygomatico-maxillary suture, zygomatico-frontal suture, and here you have zygomatico-temporal suture. And also you have, if you see here, there are two palatine process separated by the one suture line that is called as intermaxillary suture. These are the few other sutures that you need to know. Okay, clear with it? Yes, let's move further. Yes, till now we have learnt cranial bones, facial bones. Among the cranial bones we learnt paid bones and unpaid bones. Among the facial bones we learnt paid bones of the face and unpaid bones of the face, and we learnt various sutures that are present in the skull. Now the sutures are present, but types of sutures may vary. That is, plain suture. Plain suture is present between the two nasal bones. Example of plain suture is internasal suture. That is another MCQ that can be expected in your NEET examination. Also, there are squamous suture. Squamous suture is seen. See here, this is squamous suture. This type of suture is called as squamous suture, that is present between the temporal bone and parietal bone. Next is serrate suture. Serrate suture is coronal suture. The coronal suture which I have shown and explained previously, this is an example for serrate type of suture. Serrate suture example is coronal suture. And next one is denticulate suture. Denticulate suture example is lamboid suture. See here, these are small tooth-like appearances. That is the name. That is the reason why the name denticulate suture was given. This is present between the two parietal bones and occipital bone. I repeat again, these are the main types of suture lines. They are plain sutures. Plain suture example is internasal suture, and another is denticulate suture. Denticulate suture is tooth-like appearances that is seen at lamboid region, that is lamboid suture. And squamous suture. Squamous suture is separating the parietal and temporal bone. And the next type is serrate suture. Serrate suture is example of serrate suture is coronal suture. These are the most important things that you need to know regarding the human skull and type of suture lines. Now let's learn the two most important lines that are present in the human skull, which help in positioning, anatomical positioning of the skull. First I will explain you what is this is supraorbital margin, and here you have infraorbital margin. Okay, this is external acoustic meatus. You can also call it as external auditory canal. Okay, here the line that is passing from the midpoint of the external acoustic meatus to the infraorbital rim, this line is called as Reed's baseline. This line is called as Reed's baseline. Reed's baseline. Okay, this line is called as Reed's baseline, whereas the line that is passing from the infraorbital margin to the top of the or superior border of the external acoustic meatus is called as Frankfurt's horizontal line. Frankfurt's horizontal line. Okay, you got the difference, right? The line that is passing from the infraorbital margin to the center of the external acoustic meatus is Reed's baseline. reads baseline, the line that is passing from the infraorbital margin to the superior part of external acoustic meatus is Frankfurt's horizontal plane. These two are the lines that are very important for your MDS examination as well as theory examinations. Now let us also learn about some important landmarks in skull. Few important landmarks in skull are vertex. Vertex is the highest point. If you hold the skull in your hand and you palpate from the frontal to the parietal regions, you feel one point as highest point. That highest point is called as vertex. Next thing is obelion. Here you will have two parietal foramens. Okay, on the parietal bone you will have two parietal foramens from which the emissary veins and emissary vessels will come out from the cerebral part. Okay, between these two parietal foramens there is one point called as obelion. You are clear, right? Between the two parietal foramens there is a point called obelion, whereas highest point on the skull is called as vertex. And next, these parietal foramens lies, let me show in this view, these parietal foramens lies 2.5 to 4 centimeters away from this 2.5 to 4 centimeters away from the lamboid suture. This distance is also very much important. These two parietal foramens lies 2.5 to 4 centimeters away from the lamboid suture, and the point that is present between the two parietal foramens is your obelion, and the emissary veins pass from these parietal foramens. That is also very important. Yeah, let me clear this. Now we have learnt about vertex is the highest point on the skull, and obelion is present between the two parietal foramens. And next, nasion. See here, you can see this is internasal septum and here is your frontal bone. Both these unite to form a point called as nasion. This point is referred as nasion. Okay, I will repeat again. Internasal septum, there is internasal suture, and the internasal suture and frontal suture meet at a point, and this point is called as nasion. Next thing is renion. This internasal suture has tip, right? This tip is called as renion. We have learnt vertex. Vertex is the highest point on the skull. Between the two parietal foramen there is a point called obelion. This is nasion. Nasion is between nasal and frontal junction, and tip of the nasal bone is renion. Now here you can see H-shaped structure, right? This H-shaped structure is called as pterion. This is very much important for your MDS as well as theory examinations. This H-shaped structure is the union of four bones. They are, this is frontal bone, this is parietal bone, parietal bone, temporal bone, and this is sphenoid bone. Okay, these four bones unite at a point called as pterion. The main clinical significance of this pterion is, here we have two branches of carotid artery, external carotid and internal carotid. External carotid artery branches gives rise to, from here it gives rise to middle meningeal branch. This middle meningeal branch has three branches again. They are anterior middle meningeal branch, middle meningeal branch, and posterior middle meningeal branch. This anterior middle meningeal branch most commonly present at pterion region. That is the reason why I said this region is very important. the pterion region, when there is trauma at this site, then what happens is the temporal bone will compress this anterior part of middle meningeal artery. Whenever this compression occurs, in inner side we have brain, right? Inner side we have brain, so that is cerebral region. Whenever this compression occurs or there is extravasation of the blood from this middle meningeal artery, then you can see that there is extradural hemorrhage that is present in this region. Extradural hemorrhage may compress the cerebral region and ultimately leading to paralysis on the opposite side of the body. It leads to paralysis on the opposite side of the body. That is limbs, it leads to paralysis. That is the most significance of this region, and I have explained you clearly. Okay, now we have completed pterion. Here it is H-shaped structure. The main significance is anterior meningeal branch mainly passes over this region. Now we will learn another important region, that is asterion. Okay, we have done with pterion. Now we are moving with asterion. Here there is union of three bones. Again, there is mastoid process, there is parietal bone and occipital bone. Occipitomastoid, peritomastoid unites to form asterion. Okay, what are the points that we have learnt in this session? Here is vertex. Obelion is the point between two parietal foramens. Here is nasion, here is renion. This is pterion, and this is asterion. These are all the important landmarks that you should know in detail about the skull. I hope this is clear. Here I kept the diagrams directly from Chaurasia. Have a look, guys. Hope you all loved the content and enjoyed the subject. In next video I will come up with foramens and structures passing through them. Please do like and share with your batchmates and subscribe to my channel. Thank you all. See you in the next video.